I'm delighted that I now have the opportunity to introduce our guest speaker, Mr. Bill Tholl, who's a widely known and acclaimed expert on innovation in health and healthcare. Bill has lectured and published extensively on health leadership, policy, and economics. Currently, he's the founding president and CEO of the recently merged Association of Canadian Academic Healthcare Organizations and the Canadian Healthcare Association known as HealthCareCAN. N'oublions pas qu'il a également été autrefois un fier fonctionnaire de Santé et Bien-être Social Canada. Ladies and gentlemen, please join me in welcoming Bill Tholl.
Thanks very much, Krista, and it is indeed wonderful to be back home. I spent the earliest part of my career here at Health and Welfare Canada up until 1995, so it is wonderful to be back home and such a privilege to be part of this celebration. Like your deputy just observed, I couldn't believe the buzz that was in this building as I walked in and as I walked around and saw all the proud faces and excited folks here today. I've been asked to reflect a little bit on the past, maybe spend a little time very little time on the present, and then maybe look at forward under the banner of leading innovation in health and healthcare. It was interesting as we discussed a new perspective in the health of Canadians, and in some ways how little things have changed in terms of continuing to ask people to think beyond healthcare to talk about health and healthcare. The theme of my talk today is really around the power of one, and that has a double entendre. The power of one, as in you are CEO of yourself. You have a locus of influence that far surpasses anything that you might think of in terms of your locus of power or your authority, line management authority. So that's the first sense. The second is the power of one in the sense of working together as teams. And I've already seen lots of evidence of that here with your Dragon's Den and folks coming out proudly sort of, even remotely, wherever you folks are that are out there now, I mean, kind of cheering folks on from outside Ottawa. So let me, again, just begin by reflecting a little bit on my time at Health and Welfare Canada and my time since leaving Health and Welfare Canada. Back when I was here, we used to make fun of the fact that, you know, good, faster, cheaper, pick 2 out of 3, right? You can't have 3 out of 3. These days, under the banner of AAA, they have to come together. Better health, better care, better value. And some add, by the way, I think very importantly, through better teams. If you look at Saskatchewan, they've added a 4th dimension to the AAA, right? I'm going to come back to that too, and the distinction between teamwork as a term and teams that work as something we all need to strive for. I also want to share with you my definition of innovation. There's lots of technical definitions out there. For me, it is better, faster, cheaper. It's doing what invention is great, but isn't it even better to take what we already know and roll it out? That's innovation, right? Take what we know and roll it out. I had the privilege of working with what is affectionately known as surf and turf. You've heard of surf and turf, right? Minister Giz, okay, the surf part, and Minister Wall, the turf part. They came up with a Healthcare Innovation Working Group report and tabled it in July of 2012. There's an example of what can happen if you get folks together with leadership, starting with 1 or 2, and then building others in to work as one as a team. I'll come back to that a little bit as well. So this afternoon is all about shining a light on innovation as a collective, and shining a light on innovators, the individuals who have led these teams. It's a part of living a vision. I'm talking here about the Blueprint 2020 sets out a pretty
bold vision for the future, creating a world-class public service equipped to serve Canada and Canadians now and into the future. The living the vision part, I think, is really important. I'm going to come back to that. World-class, I'll talk a little bit about that as well. So, retrospective on a new perspective, which is the first part of this. You've already had the deputy kind of preempt me a little bit in terms of telling the story about a new perspective. But let me tell you that for every one of the examples I'm about to give you, there was a gleam in the eye from one that led to teams that worked as one to make this happen. So, I hate to break the news for you, but Marc Lalonde, the Honourable Marc Lalonde, did not write the Lalonde White Paper. The genius behind it, the gleam in the eye, came from a person by the name of Dr. Bert Laffamboise, who was then the Assistant Deputy Minister of the Long Range Health Planning Branch. That's where the idea of there's more to health than healthcare. Choosing your parents carefully is really important. Biology. Living a healthy, running like Dr. Taylor does and others, that fitness and environment are really important determinants of health. These words we now take for granted. Let me tell you, they were not taken for granted in 1974. Let me share another secret with you. There were 250,000 copies of A New Perspective sent out across the world. It changed the world. It led directly to the Alma Ata Declaration of 1978, which led directly to Health for All by year 2000. And when we didn't get there by year 2000, what did we do? We redoubled our efforts and recommitted to Health for All by year 2020. It's a horizon objective, but it was led by one. How many of you in this room know that potential years of life lost is a Canadian concept? Okay, the power of one. John McWhinney, working in that same branch, that generated A New Perspective in the health Canadians. You would all remember, of course, that we came up with not just the idea of the health field concept, but healthy public policy and population health under JCAP in 1986. Again, the power of one. That was Ron Draper, the then Director General, for those of you who are long in the tooth enough to remember. We've led the world in thinking about health. We also led the world in measuring health. Anybody wonder why the OECD health system of health accounts looks so much like Canada's? It's because they copied us. In 1979, a guy by the name of Jean-Pierre Poulier came over here, saw what we did, went back to the OECD, copied it. Power of one. So I could go on. My point here being that Canada has a history of leading the world in thinking about health, innovatively, thinking about innovative ways to measure health beyond age, sex-adjusted mortality rates. And for the longest time, up until relatively recently, we led the world in delivering on health. We used to have folks come from around the world to ask us, how is it that you spend so little and get so much? Anybody remember Hillary Clinton in 1995? That's what she came out like, how is it you spend such a low percentage of your GDP and provide universal health care? This is the part that I'm going to go lightly on. Things have changed. We're no longer leading the world in terms of delivering on health and health care. Commonwealth Fund study, recent Conference Board study says we can do better. It's not that we're doing worse, by the way. And let me give you my favorite example, one that I've used with Greg before. Infant mortality rates. We used to lead the world, top tercile. Sixth in the world at 6.8 deaths per 1,000 live births in 1986. Right? Good news is we're down to 4.8 deaths per 1,000 live births. I looked it up last night. 4.8 deaths per 1,000 live births. So we're making progress, right? But guess what's happened? We've dropped to 29th out of 42 OECD countries. Iceland, 1.8 deaths per 1,000 live births. What are they doing that we're not doing? How do we take this notion of what we know is happening, right? Things like, and I'm told by Dr. Sue Lee, it has to do with things like cow milk is for cows, right? Breast milk banks. So how do we take what we already know and put it into play so that we can shine a light on all of these exemplary practices and roll it out more quickly, embed it and spread it more quickly? I could go on some of these statistics, but then I'd be living up to my billing as a practitioner of the dismal science as an economist, right? Things are bad. They're really, really bad. They can only get worse. Follow me. But let me go straight away to the top 10 reasons for thinking positively about our future. You know, this is in honor of David Letterman's last show and his last top 10. So, here we go. Number 10, long history of success. Our dry spell is relatively short. Canadians still believe that we have one of the best healthcare systems in the world, and if we get off our duffs, they'll never know the difference. It's like participation. Nobody knew that it was out of play for 10 years, right? And then picked it back up again. Number 9, governments recognize the power of partnering, power of networking. I saw that today. Senior leaders realize that you can't do it on your own. There's tremendous power in networking. Again, it has to do with your locus of influence rather than power or line management authority. Number 8, top-notch researchers. We lead the world. We punch way above our weight in terms of health research. We need to take advantage of that Canadian advantage by creating a healthy research ecosystem that balances demand pull and supply push. Baby boomers, like me, will have the time on their hands and the political push to make much needed changes in the system, and they won't take no for an answer. Number 6, pockets of excellence, as I mentioned earlier on. We have these exemplars, and to borrow a term I think I used, Krista and Greg, with you folks, connecting the dots. This is the title of the report I did for you, right? If we just connected the dots in what we know in exemplary practices, we would have the best healthcare system in the world. You have a minister who I think cares, I know cares. I challenged her recently to be the next minister, not just of health, Minister for Health. Minister for Health. Jay Kep was a minister for health. And we're looking forward, by the way, to seeing your minister at our health conference in about a week and a half's time. A clerk who cares. John and I, where's John? John Hemkley. And I sit on the board of the Royal Ottawa Hospital with your clerk. And I can tell you, when she talks about mental health and creating psychological and psychological health in the workplace, I saw somebody with standard upstairs. One free of harassment, abuse, and discrimination. I can tell you, your clerk means business. She means that. Number 3, Healthcare Innovation Advisory Panel. We're all anxious to hear what the Ambrose/Naylor panel has to say in hopefully a few weeks. And I remind people, the last time David Naylor was asked to chair a national panel, what happened? The creation of the Public Health Agency of Canada happened. So Dr. Naylor is going to come out with some interesting ways for us to get back up on top. So I'm optimistic about that. Number 2, if you're still with me, HealthCareCAN and our 40 members are on your side. We're here to work with you. But the number 1 reason I'm optimistic about the future is that you're here. The public servants that are here, in record numbers, 300, I think that probably surpassed anybody's expectation for today. 320 here, and I don't know how many people that are online. You are the reason I feel optimistic about the future. So, what's your leadership challenge? Concluding with this. What's it going to take to get Canada back on top? And my answer to that is your leadership. It's sitting in this room. With our help. I came from the prairies of Saskatchewan, and it's said that you can take the prairie out of the boy, but not the boy out of the prairie. Let me tell you a secret. When you've been a public servant, you can take the public servant out of the public service, but you can't take the public service out of that person. I still see myself as part of Team Canada when it comes to health and healthcare. So let me highlight a few takeaways, though, from the work that I've recently done on leadership and health. I've co-published a book, and some of it's from that. I'm a co-PI on one of the CIHR's 4-year studies into leadership and in health system redesign. So try and keep this fairly light. The first thing we've learned and reinforced is that leadership is the key enabler of health system performance and organizational performance. The Health Council of Canada observed that in one of their last reports, and they were right. Our findings also underscore what I've seen here today, which is distributed leadership. But with distributed leadership also has to go delegated authority. Otherwise, you end up in that wacky place, that terrible place that Hans Selye used to tell us about, stress of distress, right? Held accountable for things that you have no authority over. The worst place in the world that you want to be left in. That's what causes stress in the workplace. Again, we found that your locus of influence is much greater than what you ever thought it was. In the workplace and out of the workplace. How did I get here? Where's Carol? Hi, Carol. How did I get here? Because of somebody that she bumped into riding on a bike. You know, that said, hey, well, I need a speaker. And that the suggestion was you might approach Bill Tholl. And then it came back and somebody said, okay. But serendipity, right? That's a key ingredient, right, in innovation is serendipity. Knowing what your true north is, okay? We talk about vision statements in a collective sense, and Blueprint 2020 has a vision. I want to share with you an anecdote, true story. How many of you grew up in the prairies? Okay, look at all this. So it's true to say, if you grew up in the prairies, on or near a farm, when you're 12 or 13 years old, it's a right of adulthood to be invited to take the cultivator and the tractor down the field, right? And see how good you can do. It's either your dad or, in my case, it was my Uncle Alan. All right, so he had plowed up and down the field, nice straight furrows. He says, Bill, your turn. I grab a hold of the steering wheel. I go all the way down the field, looking sideways and backwards, kind of trying to follow, as anybody would, right? Trying to follow his nice straight furrow. I got to the end of the field, turned it around, feeling very, very confident, and my furrow was crooked as a dog's hind leg. I said to my Uncle Alan, what did I do wrong? He says, well, first thing you did wrong, Bill, is you look backwards all the way down the field. Think about that from a leadership point of view. The second thing, Bill, you did wrong is every time you hit a rock and a stone in the field, you overcorrected. It took you forever to get back online. I said, so Uncle Alan, how is it that you get such straight furrows? Because there's rocks in the field for you too. He says, I take the smokestack on the tractor and I line it up with a fence post on the horizon. So that when I hit those stones in the field, I can get back right in track. The metaphor for leadership is this. You need to have your own sense of what your true north is. And it really, I was going to say it doesn't matter. It does matter what environment you're working in. And these are not great times to be in the health and healthcare business. You know, price of oil's down, right? But whatever that is, those stones that you hit in the field, if you've got your own true north clear in your mind, for me, it's always been advocating for as close as I can to a national health service for Canada. I know I can't rewrite the Constitution, but every decision I've taken or every decision I've tried to influence, I ask the question, is this going to take me towards a more integrated, more comprehensive, more accessible healthcare system or not? A former clerk who's a mentor of mine, his vision, personal vision was, he wanted to see a guaranteed annual income for Canada. After 40 years, didn't see a guaranteed annual income. But what he did tell me was, every decision he made or tried to influence, if it took us closer to a guaranteed annual income, he was for it. Think about family benefits, UI, EI. If it took us further away from that, he was against it, right? And that's, again, within your locus of influence. You don't call the shots all the time. But you can have that personal vision and know whether you're going towards it or going away from it. So, fence posts. The last point I want to make here is, and again, it's both what we found in the research, but also in my personal experience, you're going to make mistakes. I read in 2020 that risk-taking was one of the core things that, and I've seen that. I've seen some risk, right? Everybody who got up here earlier ran a risk, right? Ran a risk that the audiovisual was going to fail them, whatever. Taking risks is important. And you will make mistakes. But I love the concept, John Maxwell's, of failing forward. You know, how do you learn from those mistakes? Smart enough not to make them again, but also to share them. You know, patient safety is all about that, right? In real time, how do we share
the experience from one institution to another so that we don't mix up the anesthesia, right? And don't wait for them to make the same mistakes. So that's the same kind of concept of failing forward. I think, what we need to look for in everything we do as leaders is learning from our lessons. I'm also reminded, I think Madame Curie had 832 failed experiments before she actually got the right formula for finding radium. Do you think she gave up after those failures, or she just continued to learn? So I want to close again by thanking everybody for inviting me to be part of this. I feel really privileged. C'est vraiment un plaisir d'être ici parmi vous pour célébrer les innovations en santé. And as the policy landscape continues to change, and as you hit those stones, remember that you are the ultimate stewards of the public interest and ultimate stewards of yourself. To quote from Blueprint 2020, we can do better, full steam ahead, no holding back, straight into action. Merci pour votre attention. Allons de l'avant ensemble. Merci. Thank you.